Chemotherapy essentially functions by overwhelming the system with toxic compounds that target any cell undergoing rapid division. Because this approach lacks a precise targeting mechanism, healthy organs suffer significant damage. Standard drugs like cisplatin are often limited by their toxicity to the kidneys and the auditory system, frequently causing permanent hearing loss. As cancer cells adapt and develop resistance, doctors are often forced to increase dosages. This creates a cycle where the treatment becomes increasingly toxic to the patient, while becoming less effective against the tumor. To bypass this cycle, we have to look at the Warburg effect, a metabolic shift where cancer cells move away from normal mitochondrial energy production. Instead of using oxygen, the malignant cell begins fermenting glucose through a process called glycolysis. This shift suppresses the production of reactive oxygen species within the cell. By keeping this internal oxidative stress low, the cancer cell effectively blocks the signaling pathways that would otherwise trigger apoptosis, or programmed cell death. Overcoming this requires a compound that can protect healthy tissue from chemotherapy while simultaneously restoring the cancer cell's ability to self-destruct. This brings us to alpha-lipoic acid. Alpha-lipoic acid is a rare type of antioxidant that is both water and fat-soluble. This allows it to circulate freely through the bloodstream and pass through cellular barriers that stop other compounds. In healthy cells, it acts as a metabolic recycler. When vitamins C and E are depleted fighting free radicals, alpha-lipoic acid recharges them. Clinical studies show that when given with chemotherapy like cisplatin, it significantly reduces kidney damage and auditory toxicity. Despite its protective effect on normal cells, the compound does not prevent chemotherapy from attacking the tumor. Once the molecule enters a malignant cell, its role changes. Instead of maintaining the cell's internal balance, it begins to disrupt the specific metabolic pathways the cancer relies on to survive. Inside the tumor, cancer cells survive by turning off an enzyme called pyruvate dehydrogenase, or PDC. By keeping the PDC inactive, the cancer cell ensures its mitochondria remain dark, which prevents the buildup of lethal oxidative stress. Alpha-lipoic acid is a vital cofactor that reactivates the PDC, forcing the cancer cell to restart mitochondrial energy production. This causes a massive spike in internal reactive oxygen species. The cell is overwhelmed by its own oxidative stress, leading to DNA breakdown and apoptosis. Specialized formulations like poly-MVA, a lipoic acid palladium complex, utilize this mechanism to target the tumor's energy supply, weakening the cell's metabolic defenses. Additionally, alpha-lipoic acid inhibits NF-kappa B, a protein complex that tumors use to drive rapid cell division and metastasis. By reactivating dormant enzymes and cutting off survival signaling, the compound forces the malignant cell to execute its own death. Achieving these results require specific concentrations. Swallowing oral supplements is rarely enough, as the levels needed to directly inhibit cancer cell growth would require doses as high as 14 grams per day. To reach these therapeutic levels, integrative oncologists utilize high-dose intravenous therapy. This is a cornerstone of the Berkson protocol, which pairs intravenous alpha-lipoic acid with low-dose naltrexone. This integrative approach has been linked to long-term survival in published case reports of aggressive pancreatic and renal cell cancers. When used in this capacity, the molecule acts as a force multiplier, enhancing the efficacy of both metabolic and traditional cancer treatments. The era of relying solely on indiscriminate toxins is giving way to a more sophisticated strategy. By using precise biological catalysts to protect healthy tissue and hijack the tumor's broken engine, we are entering the age of metabolic therapy, where we don't just poison the disease, we outsmart its ability to survive.